The Deputy President Cyril Ramaphosa is expected to deliver a speech at the Higher Education AIDS Youth Conference in Durban today, and our reporter Simpiwe Makanya is standing by. A very good morning to you again, Simpiwe. From the last time we chatted, what can you tell us at this stage?
Well, good morning to you, Simpiwe, and good morning to the viewers at home. Well, around me, I see a scores of young people who are already making their way here as they get ready for the interactions and the discussions about issues of HIV, issues of gender-based violence, issues of unemployment as well, and also to highlight their grievances and how these solutions can be found around these issues. But I'm now joined by Mr. Dr. Jorgen Pile, who is the Deputy Director General of HIV and AIDS and TB at the Department of Health, to talk to us more about the program for today. Doctor, thank you very much for joining us.
Good morning.
What can we expect from now?
So this conference is really to listen to the youth. You know, the youth in the country are really struggling with a number of key issues. You know, HIV, teenage pregnancies, gender-based violence, and significant levels of unemployment. So we gathered more than 2,700 youth from around the country to speak to us, policymakers, the politicians in the country, about what their conditions are like, and also to hear from them what they think the solutions are.
If the youth speak, what is going to happen from the government side?
So we've already started, listening to the youth in small dialogues around the country. So we've got a sense of what really worries them, what their concerns are, etc. So some of the things we've done, as you may know, the Deputy President launched the She Conquers campaign last year. And the She Conquers campaign is really designed for the youth, by the youth, and we want it to be led by the youth to look at issues around teenage pregnancy and HIV. And we have focused on 22 areas in the country, sub-districts in the country, with high levels of HIV and high levels of teenage pregnancy. And we are partnering with the private sector to mentor the youth, to take the youth into internships, for example, to prepare them for the future. We're also looking at improving the health conditions, specifically what we've called adolescent and youth-friendly services in our facilities, to make them more friendly to the youth, because we know that some youth, when they go to our facilities, are turned away when they ask for contraceptives, for example. And we think that it's very important for sexually active youth to make these services available to them.
But looking at all these programs that government has got in place to try and address the scourge, are we going somehow to win this fight? Are you optimistic?
We're very optimistic. Look, we've got no choice. We've got to win this fight, because the youth of today are the leaders, not only of tomorrow, but they're leaders today, right? So we've got to win this fight. Now, we are optimistic because we see evidence, even though the evidence is small at the moment, the decreases are small. We see evidence of declining teenage pregnancies in some areas, declining new HIV infections. And we see that, when Stats South Africa does this survey, there's a significant number of youth who are becoming entrepreneurs, taking care of themselves, becoming very innovative. And that's what gives us hope for the future.
Well, when you look at the statistics, Dr. Pile, you see that a lot of young women in particular get infected with this virus. How is it going to be addressed, the issue of women getting infected with this virus?
No, that's a very good question. Now, we must remember that the young women are not infecting themselves. They are being infected by men. And these are slightly older men, especially the 18, 19-year-olds are being infected by 29, 30-year-old men, and some much older as well, the so-called sugar daddy perspectives. We have to firstly make the women resilient, make them aware of the dangers, the HIV pregnancy-related dangers of having these sexual relations with older men. And we must also get the men really on board. This is, as the Minister of Health keeps saying, it's an all of society, all of government response that we must make. So working together with local communities, with families, in schools and in our health facilities, and working together mostly and being led by the youth. And awareness is an important activity as well, that the youth need to be aware of some of the dangers of some of their actions.
Doctor, thank you very much for your time.
Thank you very much.
Thank you very much. Well, that was Dr. Pile from he's the Deputy Director General of HIV and AIDS and TB at the Department of Health. Well, the news that we've just got is that the Deputy President, Mr. Cyril Ramaphosa, will no longer be coming to be taking part in this conference. Mr. Mduduzi Manana, who's the Deputy Minister of Higher Education and Training, will be taking his place rather. It's back to you in studio.